Good evening, everybody. My name is Sebode Nelson, and I'll be giving an introduction of what medical laboratory science is all about. Medical laboratory science is a profession that deals with the analysis of several samples like sputum, blood, urine, stool, and so many others for the diagnosis of illnesses. And this department is divided into different specialties. We have the histopathology, we have the chemical pathology, we have the medical microbiology, who is a medical laboratory scientist? A medical laboratory scientist is a professional who has undergone a 5 years rigorous training in an accredited institution and a 1-year compulsory internship program, of which this person or this professional will be equipped with the analysis and diagnosis of patient specimens in different areas. Like I said earlier, we have the histopathology and the cytology units, we have the chemical pathology unit, the hematology and the blood transfusion unit, and we have the medical microbiology units. Now, the medical microbiology unit is subdivided into different other subdivisions, which is we have the bacteriology, we have the virology, we have the mycology and parasitology units. Now, these various units make use of different samples in their analysis. The parasitology units diagnose various parasites that affect an individual, which are the Ascaris lumbricoides, the Trichuris trichuria, we have the Ganja labia, we have the Immunology nana, and several other parasites that can affect an individual from these two samples. Okay, there are different analyses or different tests that are being done in the medical micro department. We carry out the sputum MCS, urine MCS, blood culture, the vaginal swab diagnosis, and so many others. And these analyses are done for patient illness and to guide the clinicians on what to do and the treatment the patients need for them to be okay and for them to be treated. And most times, the medical laboratory scientists are professionals that will actually work behind the scene, even without the knowledge of the patient. We don't interact with the patient, instead we interact with the sample. And we see every sample as a patient and we treat them as if we are handling life. So the hematology unit is another important part of the medical laboratory science field, which deals with the analysis of blood samples for different illnesses like the peripheral blood film, reticular counts, full blood counts that has many parameters, the WBC, the platelets, the hemoglobin, and even the hematocrit. And this blood transfusion unit also involves the hematology unit, also comprises of the blood transfusion unit, which deals with the screening of donor and recipient to check the compatibility between the donor and the recipient during blood transfusion. And this is done by collecting the donor's blood sample and cross-matching it with the recipient serum. And this is done under the blood transfusion unit. And this is a very crucial step in transfusion studies, because if the samples is not well diagnosed to check for transfusion transmissible infection, such as the hepatitis B, hepatitis C, the HIV, and VDR, and the syphilis. And these infections are being checked so that these infections are not transfused to a patient who is already suffering or who is already sick. Regardless of the emergencies in blood transfusion units, these TTIs is expected to be checked to ensure that this blood is good enough for the patient. Okay, and the chemical pathology unit is a unit that analyzes patient blood sample also for different parameters, just like the liver function test, the EU creatinine, which is the electrolyte urea and creatinine, and also hormonal assay. And the histopathology unit. The histopathology unit also talks about deals with different specimens like the pleural fluid, the ascitic fluid, the pap smear, and even other harvested abnormal tissues for different assays, which are stained using different staining techniques like the H&E, which is the hematozidine and eosin, the the Perspicacious blue staining techniques, even the hematology by Jasmine staining technique. These techniques are used in histopathology to stain for general tissue structure and different other parts of the tissue to be able to diagnose what is the actual cause of the patient's illness. Like I said before, the medical laboratory science is a profession that is diverse, that is wide, that is broad, and has different aspects to explore in it. And these are, like I said before, these are professionals that are trained. And these all parts and all divisions that I've mentioned in this video are different aspects where a scientist can actually specialize in this aspect and be very good and competent in this aspect. I believe I've been able to enlighten you about what medical laboratory science is and who a medical laboratory scientist is also. And I believe there are many more videos that will be coming from me about your health, about medical laboratory science. So do well to subscribe and like this video for more. Thank you very much.